A warm welcome to today's talk, Tuesday the 13th of December. Now I'm going to be looking at a bit of a COVID update today from the United Kingdom, but I think the applications are pretty clear wherever you are. First thing we're going to look at is people are less likely to report long COVID if they're working or looking for work. Now this has clearly got implications and we won't be shying away from that. We're also going to be looking at the record number of people on long-term sick in the United Kingdom. This is not attributable to COVID, so what is going on? We'll be looking at that. And excess deaths in the UK and indeed other parts of Europe are still higher than we would expect for the time of year. About 5.1% higher currently in the United Kingdom. And I'm reporting from a very cold north of England. If I just give you a quick glance out the window, you'll see what I mean. It's all kind of cold and frosty out there. And just between the two of us, I'm currently wearing 2 thermal vests, but don't tell anyone that. Now, I want to start off with the symptoms of COVID because it's becoming more and more cold-like as time goes on. This is from the Zoe data, the health study. Now, these symptoms here, like sore throat, there's more sore throats than there has been. Higher proportions, more runny noses, more blocked noses, more headaches than there has been, and more sneezing than there has been. All of these symptoms are increasing in the number of people that report them. So clearly we can see that there's more and more common cold type symptoms being reported from people that experience COVID. And these are people that have been diagnosed positively with COVID. So 64% of people diagnosed with COVID get a sore throat, 57% get a runny nose. And we look at the other features as well. Cough with no phlegm, again, very common cold features. Cough with phlegm, 44%. The hoarse voice, 40%. Muscle aches, 24%. Altered smell, down to 20%. Swollen neck glands, down to 19%. Dizzy lightheadedness, fatigue, loss of smell, all less common than they have been in the past. The common cold symptoms are becoming more prevalent, and generally speaking, the systemic symptoms less. Sore eyes at 17%, short of breath down to 15%. Glad to see that one's well down because this was the main reason for hospitalisation, and it is well down on what it has been. Chest pain, tightness, also a very disconcerting symptom, down to 15%. Earache, chills or shivers indicating that the temperature is probably going up, down to 13%, and well, it's down on what it was months ago. It's actually a couple of percent up, I think, on what it was last week, but it's at a lower level than it has been. Wheezing, 11%. So we are seeing this continuing trend towards more common cold type features and less severity of illness. Not always true, but that is the definite trend. Now, here's some interesting Zoe data. These are people with diagnosed with common colds, and these people diagnosed with COVID who have common cold type symptoms. And as we see, there's a lot of common colds at the moment, more people with common colds than with COVID type colds or other COVID features. But we do see an increase in the number of people with COVID. Now, having started talking about long COVID, I'm going to start off with that now. Self-reported long COVID, 3.4% of the entire UK population, 2.2 million people. Huge numbers reporting long COVID. As of the 6th of November, when the data goes up to from the Office for National Statistics, 87% had had it for more than 12 weeks, long COVID, self-reported long COVID, 55% for over a year, 27% for 2 years. So we do see a significant burden of morbidity here from what is attributed to long COVID. More on that in a minute. Symptoms: fatigue, difficulty concentrating, shortness of breath, muscle aches are the most common features with the percentages indicated. And the long COVID symptoms adversely affect the day-to-day activities of 1.6 million people, 75% of those who report long COVID. Now, there's a definite long-term illness going on here. It's attributed to long COVID. Maybe there's other factors. Let's look at some other things that might give us a clue. Most common in Ages 35 to 69, more common in females, more common in people living in deprived areas, more common in people working in social care, those that have another activity limiting disability, and people not working or looking for work is the way the ONS put it. Let's translate that. What that means is, if you are working or actively looking for work, you're less likely to report long COVID. So people working and people looking for work, less likely to report long COVID. Is there some biological cause for this? It's rather hard to imagine. Does this mean that some people reporting long COVID are not suffering from long COVID to the degree they are saying? Yeah, it does mean that. Does this mean there's a degree of malingering going on here? Yes, it does mean that. That's my view. The vast majority of people reporting long COVID symptoms, however, are genuinely ill. I know at least half a dozen of them personally. And through other contacts. It is a genuine phenomena what is going on here. Is this purely sequelae of COVID, or are there other things going on? Now, interesting to note, the proportion of people with long COVID on the Office for National Statistics, the vaccination status is not given. Now, of course, every time we talk about this, we talk about long COVID symptoms, people want to know what proportion were vaccinated, what proportion weren't vaccinated, how many have had how many doses of vaccine. We're not told that. You would imagine that because the government's still trying to promote the COVID vaccination programme, they'd want to point out how protective vaccine was against the development of long COVID. How that the people with long COVID are much more likely to be unvaccinated or have vaccines ages ago. You would think they'd want to point that out, but they don't. They don't take this opportunity to point that out. They simply ignore the data. The proportions are not given. So frustrating that the government have missed this opportunity to show how efficacious vaccination is in preventing long COVID, if indeed it is. Is it? We simply don't know. We simply don't have the data as far as long COVID is concerned, which is a great pity. Now I'm going to look at some other interesting data going on. So that's the colds versus COVID colds there. So on this graphic we see that the number of cases in the UK is currently increasing in terms of COVID, but we know that's true anyway from this previous graphic where we compared it with common colds. Not at all surprising this time of year, more people indoors, mucous membranes are cold, vitamin D levels go down. It's not surprising there's more infections, really we would expect that. What's actually a bit surprising is that they stayed low for quite a long period of time there. Our value at the moment, probably about 1.1 in the United Kingdom generally. Now across the home nations, pretty well moving together really. Now I know that looks like there's higher levels there in Northern Ireland, but this is because there's less people submitting data in Northern Ireland, therefore the smaller number of people means that the data is more erratic. I don't think it represents anything more than statistical sampling. So basically the pandemic much the same across the UK. As we see cases in England going up slightly from the Office for National Statistics data. This will be up again next week because this data is always a little behind the Zoe data. Now this is interesting. So we see infections in the UK here are going up a little now. So there's an increase in infections. And remember, this is based on Office for National Statistics sampling. We know from Professor Fenton yesterday, if you could catch that video, that it's not ideal the way this sampling is done, but it's what we've got, and it is based on a sample of, I think Professor Fenton said 39 million people. So it's not all the population represented by any means, but it is a good sample size that the Office for National Statistics take. So they're the infections. But despite infections going up, hospitalisation is going up as well slightly, but deaths, I'm pleased to say, are going down. And when we look at the hospitalisation data, we'll see that a lot of those are incidental admissions. So basically, again, this is consistent with what we've been talking about for some time, that although cases are going up, Hospitalizations are up a little bit. Intensive care admissions there remain low, but deaths are going down, as typically the severity of the disease is becoming less as more and more people develop immunity. We've expected this for a long time now, and we are seeing it. Incidence across the age range at the moment is more younger people, but we do see an increase in all age ranges in terms of the United Kingdom at the moment. Again, not surprising for the time of year. Now, this is the proportion of people hospitalised. These people here are hospitalised, are incidental findings of COVID during hospitalisation. These people are hospitalised primarily for COVID. So we see that it's actually under 40% of people that are hospitalised who have COVID are hospitalised for COVID. And this is a continuing downward trend that we're seeing as well. And intensive care, it's even more pronounced. So it's only about 30% of people admitted to intensive care are for COVID. The rest are incidental findings. Now, this is the number of people vaccinated. Over 14.5 million people aged 50 and over have received an autumn booster in England. That's in England alone. Personally, my last vaccination was, I think it was the 20th of November 2021. It's over a year ago, so I'm not included in these numbers. But that's the vaccination status overall in the UK, in England rather, in the over 50s. Now, we're going to be looking at this in a minute. This is there's an increased number of people on long-term sick at the moment. So not only have we had this problem with increased deaths, we've got more people on long-term sick, not COVID related. So two problems, morbidity and mortality. I'm going to be looking at that in a minute, so I'm just going to skip that for now. This is the excess deaths. Now, the blue deaths here, you know, are COVID. The black line is what we would expect, and the green are other excess deaths above the average. And when we look at that in a bit of a blow-up, again, we see that there has been excess deaths above what's been expected for the time of year for some time now, but it is decreasing. And this, to be quite honest, is quite a relief. The idea that the excess deaths would have gone on rising was a little bit frightening. They are starting to go down now, but still an awful lot of people have died, and it's still largely unexplained. We still don't really know why this is, and there's still no national debate about it. Mainstream media doesn't seem to discuss this at all, despite the huge numbers of people that have died, more than we would expect. And in fact, we would expect less people to be dying at the moment, because the people that died in the pandemic were the most vulnerable. And given that they've already died, we would expect the population that's left to be healthier. Therefore, we'd expect excess deaths to be lower than average, but they've been higher than average for many months now. And we've had no satisfactory explanation for this, unfortunately. Nor do people seem to be talking about it as much as I would have expected. Now, also talking about the unexplained things, this is the cumulative change in the number of people aged 16 to 64 inactive because of long-term sick. So people basically on long-term sick, and we see a really quite dramatic increase. So this was the start of the pandemic here. And ever since then, we've seen an increase. Now, it's not surprising because we had pandemic factors maybe here and here. But what's causing this increase here, we don't really know. We do know it is not directly COVID related. How do we know that? Because this is a direct quote from the Office for National Statistics. Long COVID is not the main factor. So we need a real free and open and transparent debate, really, on why these numbers are so high, and we need something a bit definitive on this. Why so many people are off sick, because if people are on long-term sick, this is just devastating for the individual and their families. This is a huge number of people, as we see, over 500,000 from this graphic, and a huge increase, not COVID related. So working age adults who are basically on long-term sick, it's been rising since 2019. There's 363,000 more than at the start of the pandemic. This is a big increase. Now, you'd think the Office for National Statistics would go through quite a few possible reasons for this. Unfortunately, they don't. All they say is NHS waiting times is the main factor. Is this a factor? Yes, of course it is. Are there other factors? I strongly suspect so, but the Office for National Statistics doesn't discuss them, nor are they being debated on mainstream media to any degree at all, which is surprising. So long-term sick. Now this category here, other health problems or disabilities. Now this may include long COVID, but from April to June 2022, there's 97,000 higher than the same period in 2019, a 41% increase. So we need a debate on what these factors are. What is going on here? Why are so many people on long-term sick? Why are more people dying than normal? And why have more people died than normal? And given the numbers that are involved here, it really amazes me that this isn't the top topic of discussion. And it certainly surprises me that the government is so quiet on it, that it's not being debated in Parliament. It just seems very strange. Now, excess deaths, ending the 2nd of December, there was 372 deaths involved with COVID-19 registered in the UK. That's 2.9% of all deaths, down from 400 in the previous week. But there's a total of 12,866 deaths in the UK of OK people die. But we do know that that's still 5.1% above the national average. And as I say, it's quite a relief that the excess deaths, which seem to be increasing week on week for such a long time, are starting to go down now, but it still represents a significant increase, and a lot of people have died and are dying and are on long-term sick. And I don't believe this is explicable all by NHS waiting lists, although that is a problem. And the Office for National Statistics says it's not due to long COVID, so we really have to be looking for other factors, and we really need a bit of a open dialectic debate on that, so we can work out what's going on. And why people and official government sources are so quiet on this really is bemusing, because we're dealing with a bit of a health is catastrophe too strong a word? A very, very significant issue because of the increased morbidity and mortality. So that's where we are now. But as COVID itself moves towards less pathogenicity, typically it's becoming milder. Some people are still getting sick, of course, but typically as immunity increases in the population, the severity is becoming less, which is good news. And I think we can carry on looking at this pattern which is just as well, because this virus is going to be endemic for a good period of time, possibly a decade or more or two. That's all for today. Thank you for watching.